Hey folks, Kevin here. Well, it's March 19th, 2020. I'm over in the work area working with some of the seedlings, trying to get some things done, but I thought I'd try and respond to some of the questions that I've gotten recently about the infectious disease process that's affecting many of us throughout the globe at this point. And so a couple of the questions, I got a couple from Mars rover. He had asked a few questions. He had been in search of, geez, have people been using ozone as a therapeutic process? He talked about topical ozone, transdermal via steam sauna, ultraviolet light, and vitamin C. So I don't have much experience with a couple of these therapeutic interventions. There's lots of misinformation on the web about vitamin C. So we can take vitamin C all day long orally, and it has no scientifically proven therapeutic benefits when massive doses of vitamin C are given orally for any of the disease processes. However, very high doses given intravenously, there are several papers showing the potential benefits, but giving it orally has negligible benefits. So, and that's the only information. I don't take vitamin C. Because of our diet, we get plenty of vitamin C all the time. As far as ultraviolet light is very good at killing infectious agents in environments and all. I think that maybe sometime in the future we'll be incorporating UV light in different vehicles and places that we're spending some time, that when we're not in there, they could get a dose of ultraviolet light and potentially help to disinfect the environment without using a lot of cleaning agents. So that's a possibility. No papers that I've seen as far as it being applied in that way that I just mentioned. As far as ozone goes, I don't have any experience with ozone. Using it topically potentially could be like a hand sanitizer, potentially could be very beneficial for killing the agent. I think soap and water works extremely well if you're sing happy birthday twice, or you count to 20 slowly, 1,000, 2, 1,000, and wash your hands, which none of us do. I mean, if you're guys, you visit the urinal and you may not even wash your hands. So this is a good time to start just doing some really good practices. And if you want to be super clear about it, you could wash your hands, wet your hands first, lather up really well with soap, go through the whole process with your thumbs, doing the whole process, all means and all, rinse them thoroughly, and then repeat the process. Do it 20 seconds twice. That would probably take care of it. Or do the whole process once and then put hand sanitizer on, those gels with a high alcohol content, which will stay on the surface for a prolonged period of time. Alcohol by itself evaporates too quickly, and it isn't going to have the contact time to kill the organisms. As far as ozone given transdermally, Mars rover mentioned that, and I haven't found anyone who's using that, but transdermal is a means of delivering medication to a patient. So everyone's familiar with oral administration, topical, some eye drops we may put in, or nasal drops. So we got topical, oral. We have injectable, which can go intramuscular. It can go intravenous. It may go under the skin, subcutaneous. And then there are other means that we can use as well, including transdermal. Now, transdermal can be given just locally, like a lidocaine patch or a fentanyl patch, to potentially really help with the pain associated with a very specific spot on the body. And that isn't just local either. They are systemically distributed after a period of time. And then we have transdermal that's actually intended to distribute throughout the skin surface or throughout the subcutaneous surface. And then we have transdermals that are meant to become systemically absorbed as well. Transdermal seems to be a very dangerous utilization of delivering ozone, which is an oxidizing agent. So I think we could do a lot of damage to our cells, our capillaries and all by using ozone as a transdermal, meaning going through the skin and getting into our system. It could potentially cause significant injury. So those are my thoughts on that. If there's any papers that you're thinking about and you want to put a link to them in the description below, that'd be great. In the comments below, sorry. I got a question about I guess, what is the incubation period? It's actually, if you get it, is it always 15 days quarantine? That's the question. About symptoms and all, I'm not going to get into the symptoms right now. They're very similar to flu-like symptoms. And of course, it could mean severe shortness of breath, difficulty breathing, cyanosis, looking a little bit blue instead of being pink, those sorts of things as well. And what's the other part of this question? My brother wrote this. He texted it to me. So how long before the symptoms start to show up? So the incubation period for this particular infectious agent is generally accepted to be between 2 and 14 or 15 days. Let me just stop here for a second and just share with you that the process of disseminating accurate information is painstaking, because in order to find out the best information, we don't go to YouTube, we don't search the web for some of our favorite sources, or just listen to the news briefing that the president gives and all. I think we really need to go to the journals, the New England Journal of Medicine, the Journal of American Medical Association, the epidemiology sites, going to the CDC, Morbidity, Mortality Weekly. So there's so many different papers that and letters that are submitted to the various journals. And some of it is some really well compiled data. The longer that people have been, scientists and researchers have been following this in China or in South Korea or in Italy or France, wherever it may be, there's data getting compiled, and their impressions and their potential therapeutic, the potential benefits of their therapeutic interventions as well are being shared. And it's going to be at least a year before we really can take all that information and do a meta-analysis, taking all that data and trying to weed out the erroneous information, the outliers, and really get down to the information that's going to tell us, well, how does this disease actually behave? Who's affected, which disease groups, and we certainly share that. We talk about the elderly people being most severely affected, but there are young people that are seriously affected as well. And I'll get into that stuff in just a minute, but it's a real challenge trying to make sure that we're sharing with you. I'm trying to make sure that what I share with you is accurate information, timely now, but it's always subject to change based on what we learn as more research, more data gets added to our research pool that can be analyzed and make intelligent, share intelligent thoughts about what we've compiled thus far. So there's so much misinformation out there that it's frustrating at times. So the incubation period, and the definition of incubation period is from the time that you become infected. So you were exposed to someone who had the infection, you got it by whatever means, got into your respiratory system, from that time 0 until the time that you show clinical signs. So the time that you recognize, hey, you know what, I'm not feeling normal, I've got a cough, or I feel ill, or I've got a headache, or I don't have the energy. That may be between 2 days after the becoming infected to all the way to 14 or 15 days. There are outliers beyond that, but that seems to be the comfortable range that I want to share with you. The average or the median number is really, they say 5.25, something like that, or 5.3 days. So if you take a large population of people who have been infected and you ask them when they first started showing signs, and they'll know that they've been infected because when they do backward tracking and find out when they were exposed to someone who was traveling at that time or whatever it may be. So early on in the process, if we do good tracking, we can see when the person was infected. And then we can say, oh, it took so many days. And there's lots of statistical and epidemiological information that we can gather from this initial data. There's lots of stuff I haven't shared that's fascinating to tell, geez, how big of an outbreak is this? That would be one thing that is sort of a scary topic. But so the incubation period, let's say, is about 5.25 days, but could be as early as 2 days, could be as late as 14 days. And that's when you're showing clinical signs. Now, how important is that? Well, that may be important to an individual who knows, oh, Bob was infected, he was over here 3 weeks ago, I guess I'm okay. So that's really good information for that individual that says, oh, we're beyond that period of time, even though he's a confirmed infected person. So that's great information for that individual. But as far as for the general public, that really isn't that beneficial. And the reason that it's not that beneficial is because you can be transmitting the infectious agent before you show clinical signs. So you're spreading the disease at 5.25 days if you're in close proximity to other people, or those people have touched things, or even, with aerosolization. We can talk about that in a second as well. So another question I got, I hope that answers that question fairly well. A doctor says not to use any ibuprofen, use only Tylenol if you get symptoms. So about the Tylenol and ibuprofen, I think this all stems from reports of Reyer's disease, or Reyer's syndrome, R-E-Y-E-R-S. I can't remember if it's Reyer's disease or Reyer's syndrome. You can Google it and look it up. These were small children that were, I think they had the flu, they had a viral infection. And when treated with aspirin, which is a very specific type of non-steroidal anti-inflammatory drug, as opposed to ibuprofen, and there was reported central nervous system signs, so brain, I think spinal cord as well, but I know the brain was affected, and I believe the liver was affected in those children. And it was proposed that this caused mitochondrial damage in these, and that's the powerhouse inside of our cells. So it caused mitochondrial damage inside of these children, which allowed, it diminished the children's ability to fight off this viral infection, and then the viral infection went off haywire. I believe that's how it goes. It's been years since I've thought about that disease syndrome. But I think what's happening is people are extrapolating information, say, well, if this was a concern for this virus, potentially it's a concern for the one that we're dealing with now. It is a possibility. Is it likely? No. If you're taking Tylenol or acetaminophen, do it by the labeled dosage. Don't be taking lots of it. Certainly don't be drinking and taking acetaminophen or a Tylenol. Those are two key points that I'd suggest. So I think one of the things that is confusing people is trying to understand how come this is such a big concern. Everybody's making a big hoopla out of it. They're the flu is, the flu kills so many people each year. And of course, the young people, I see these on YouTube. I see some images from news broadcasts that I see. where the millennials or people in their 20s and 30s or even in their teens at spring break and large gatherings and all. And for me, I'm extremely concerned. And the first reason that I'd be concerned is all of these people are going to be spreading the disease pretty rampantly, because now we know that there's research showing that, and again, this data all has to be researched, but there's not peer-reviewed article that's been submitted. I think this was JAMA. This was the New England Journal of Medicine, indicating in this one study that that this remains airborne. Now, when we think about things, infectious agents that are in our respiratory tract, when we sneeze or we cough, these droplets, which can travel as much as 6 feet, if it gets on an object or if it gets on us and we touch our eye, we touch our nose, we touch our mouth, or it's fresh stuff that hits our salad and we eat the salad right then we become infected from it. And that's all true. How long does the virus last in the environment? Well, this study looked at a few things, looking at paper and cardboard versus, I think, copper and stainless steel. So being on these very common materials and all, it has a very short lifespan on paper products, cardboard products, but it could be potentially much longer, a couple of days, on stainless steel. But the thing that I found so concerning is that this, besides in the droplets, aerosolization, so those are really, really tiny, a half a micron in size, and they defy the laws of gravity almost. So they can, if someone walks into an elevator and sneezes and coughs up a good storm, they could actually leave the elevator, and it could be in the elevator for minutes, and you could breathe it in. If you're outside with any sort of breeze, I think it's much less likely. I wouldn't want to place myself downwind. This certainly makes sense for some of the previously reported articles where person A, the person who was infected a couple of people 3 seats ahead of them and a few seats behind them. So being in an aerosolization means of transmission makes sense for those reports. So when I see young people or any people gathering in especially in enclosed environments like a bar or a tavern, whatever things are called nowadays, these potential infectious agents could be airborne, and I don't want to over dramatize this. One could inhale it, so that is a concern. It's important to realize something else about this infectious disease process. So this is a zoonotic disease, and when I say zoonotic disease, I'm talking about something that's been living inside of an animal species, and it gets transmitted to people. So that's a zoonotic disease. And one of the concerns that I have is, I talked in the last video about that high peak and how we want to flatten the curve so we don't exceed our medical facilities' capacities. And these disorders, these diseases that are brand new to the body, that the body has never seen before, is of critical concern for the healthcare workers. So they're in the environment working in close contact with people who are presumed or determined to be infected and trying to help them. And they have to be concerned about their own health and well-being at the same time. And unfortunately, some of these many of these healthcare providers are going to be ill. Despite doing everything correctly, some of them are going to die. So we owe it to our healthcare service providers, we owe it to our elderly, and we owe owe it to ourselves and to our companions and friends not to be very cautious in how we behave so that we reduce the chances of transmission. So I'll share with you one of my experiences as a clinician. Years ago, I was responsible for teaching fourth-year veterinary students emergency critical care practices at Cornell years ago, and I had a case of a patient who had leptospirosis. Now, leptospirosis is a bacterial infection, and dogs can become infected with this bacterial infection, and there's several different serovars, different types, different family groups of this leptospirosis, this type of bacterial infection. And this infectious one, I suspected that was, and it happens at a certain time of year with the changes in the weather as well. And so I really suspected that this patient that came in had leptospirosis. And you don't wait for the diagnosis because that actually takes some time to do it. But you treat the patient as aggressively as is necessary, but you also have to make sure that you're doing all of the protective means to protect yourself. And especially for me, I have fourth-year veterinary students that are going to be doctors in just a couple of months. And I'm responsible for their health and well-being as well. So we wear safety glasses, we get gowned up, wear sterile gloves, our sterile packs, everything that we're dealing with. And we have to, and this patient was in what's called anuric renal failure. Renal failure means kidney failure. And when we say failure, we mean the kidneys aren't even able, anuric renal failure means they're not even producing any urine at all. And our goal is, well, we need to get rid of those waste products and restore all of the functions of the kidney. But these patients are just flat out, they're going to be dead if we don't intervene quickly. And in many cases, they go right on dialysis. But a lot of people can't afford that. So we try to induce what's called diuresis. We try to give them intravenous fluids to the point where they get rehydrated. But if their kidneys can't produce urine, then we flood them and they die drowning in their own bodily fluids. So we have to kick those kidneys into producing urine. And so we do what's called ins and outs. So once the patient is rehydrated with appropriate fluids and all, then we have to measure exactly how much urine they're producing. And we use that in our calculation. I won't go through all the calculations, but we need to know exactly how much urine they're producing so that we don't overdose them with the intravenous fluids. So it's so important when we're doing this that we quantify, we measure the amount of urine they're being produced. So we have to put a urinary catheter in their urethra. And this can be very challenging. It can be daunting to a fourth-year student who has all of this knowledge in the world, and they're kind of excited or kind of apprehensive about placing a urinary catheter up through the urethra, getting it into the bladder, and then we set them up with a system where we can measure the urine production. So my story goes like this. The students are all keyed in. We've gone through the whole procedure, step by step, how things are going to happen. We're all gowned up. Everyone's wearing everything that they should be wearing. And the student who was placing the urinary catheter under my guidance was starting to place it and all, and got a bit frustrated because there's some challenges, especially in female anatomy, trying to place a urinary catheter into the location. However, that whole area is contaminated with that bacteria, with that infectious agent. And they're all gloved up and all. We're being very careful and very cautious. She backed out and had her catheter in there. We discuss it and we're trying to decide, do you want to have a second go at it, or do you want the other student who's placed one successfully before to go in? And before I knew it, she moved like this. And of course, a urinary catheter is a very slender tubular apparatus. And when she went like this with her hand, a couple of drops of the urine went right by, went behind my glasses and got right in my conjunctiva of my eyelid. And I was pretty certain that this patient did have leptospirosis, and I won't go through the whole process and all, but I ended up getting the zoonotic disease. Aside from me being completely gowned up, sterile gloves, all the equipment, head protection as well, but that droplet found its way behind my glasses and hit my conjunctiva. Everything turned out fine. The patient actually did very well as well. But that just is an example of, even with being completely gowned up with the very best state-of-the-art equipment and being very well trained, our people who are on the front line can potentially become infected, and that takes them out of work for that period of time, or in some cases in countries, they keep working because they're assuming all the patients have that infectious disease. And that's very concerning. So all of us citizens out there, even the young, we need to really take this very seriously. This is a pandemic. This is a rapidly replicating, easily transmissible, and with a significant degree of morbidity, illness, and mortality, death. So we have to take this very seriously. I wish there was a more eloquent way of saying our government has failed us as far as conveying in a timely manner what needs to be done in a clear and conscientious way of disseminating this information and getting the equipment to everyone. Now, there's lots of learning opportunities from this whole process. Lots and lots of opportunities to learn, because we're going to have more pandemics. Global warming is an issue, and that puts pressure on all of these different animal species. And this is not to get anybody in more of a panic. This is to just say, let's learn from this situation that we're going through now. Let's have best practices as citizens to try and stifle this disease process so we can blunt that transmission. We can slow the transmission of this disease from one another. Have serious talks with your friends and family about going out and doing things. Have those conversations in a very mature way. Let's not panic or scream or yell at anybody or call anybody names. Let's do the right thing as citizens and educate each other about what our responsibilities are, because we may be inadvertently causing more morbidity and mortality and take out some really, really amazing people that have the potential of making changes in our lives in the future. Yes, this is an economic crisis around the globe as well, but civilizations can be destroyed as a result of pandemics. The market is one thing. That'll take care of itself if we do the right things to support ourselves. I think that's as far as I want to go with this video today. I don't want it to be a downer. I'll make a video soon. I got one more response to comments and all in another video that I want to make before I make the next one about this. But there's so many things that we can be doing to make our lives better, learn from these situations that we're going through now. These are things that we can anticipate. You go back on YouTube, you'll see lots of videos talking about pandemic. It's not a question of if, it's a question of when and what the severity is. This isn't as severe as some of them can be. It's highly infectious, and yes, it's going to kill a hell of a lot of people, and that's terrible. But it's unacceptable if we don't take responsibility for the way that we act and the way that we communicate with each other. We don't call names to any cultures or groups. We treat people with respect, and we do the right thing. If you have any comments or questions, please leave them below. And by all means, folks, take care, stay safe, think positive. Bye-bye now.